Here we'll learn the external features of the heart and how it attaches to the roots of the great vessels. Begin with the anterior surface of the heart. Outline the heart. It's roughly triangular in shape. In anatomical position, its apex points slightly towards the left side of the body. Internally, the heart's divided into four chambers, which will approximate on the external surface. The smaller chambers, the atria, are superior and the ventricles are inferior. Draw the auricles, they're ear-like extensions of the atria. When necessary, these pouches can expand to accommodate blood flow. Then inferior to the auricles, draw the visible portions of the coronary sulcus. This is a shallow depression between the atria and ventricles. Show that the coronary sulcus provides space for the coronary arteries and the great cardiac vein. We show that epicardial, adipose fatty tissue surrounds the vessels. Then draw the anterior interventricular sulcus between the right and left ventricles. The anterior interventricular artery and vein travel within the sulcus, surrounded by fatty tissue. Next, we'll show how the great vessels attach to the heart. On the superior aspect of the heart, show that the pulmonary trunk arises near the left auricle. The pulmonary trunk splits to form the right and left pulmonary arteries, which carry deoxygenated blood from the heart to the lungs. Next, show that the aorta arises at an angle and wraps around the pulmonary trunk. Label the ascending segment and the arch of the aorta. The aorta delivers oxygenated blood from the heart to the rest of the systemic circulation. Then draw the superior and inferior vena cava, which lie posteriorly. They return deoxygenated blood from the body to the atria of the heart. Lastly, show the paired right and left pulmonary veins. These deliver oxygenated blood from the lungs to the posterior aspect of the left atrium. Now the posterior surface of the heart. Again, show that the atria are located superiorly and the ventricles are inferior. The base of the heart's the widest part. It primarily overlies the left atrium. Between the atria and ventricles, draw the coronary sulcus. Show that it contains the coronary sinus, small cardiac vein, right coronary artery, and the circumflex branch of the left coronary artery. Then between the ventricles, draw the posterior interventricular sulcus. Show that it contains the middle cardiac vein and the posterior interventricular artery. Now we'll draw the roots of the great vessels. First, show the superior and inferior vena cava drain into the right atrium, and the pulmonary veins drain into the left atrium. Blood's delivered from the lungs to the atria via these vessels. Superior to these veins, show that the pulmonary trunk arises from the anterior surface and splits to form the pulmonary arteries. Lastly, show that the aorta arises anteriorly and wraps posteriorly over the pulmonary trunk. The pulmonary arteries and aorta deliver blood from the ventricles to the body. Notice that the vena cava and aorta, which are the primary branches of the systemic circulation, extend along the vertical axis of the body. The pulmonary arteries and veins run more horizontally because they transport blood to and from the lungs. They are situated to the right and left sides of the heart. This concludes our diagram.